The views and opinions expressed during this program are those of the host, guests, and callers, and are not necessarily those of this station, its management, or other employees, advertisers, or sponsors.
Good morning. It is Wednesday, June 4th. I'm Michelle Dials, and you're listening to Talk of the Town on 1230 WSAL. Joining me this morning from Logansport Memorial Hospital, Vicki Bird is here. Good morning. And you have a lot of guests with you this morning.
I do. I have several guests. We have Dr. Barry Karras, who is with the Franciscan Physician Network, our new cardiology program, Jim Schrader, and two of the staff that also are working with the doctor. So we're here to talk about our new partnership with Franciscan's cardiology program, and I'm going to turn it over to Jim.
Good morning. Yes, we're excited. Our partnership with the Franciscan Physician Network for Cardiology to expand the services to our community and partner to expand coverage of cardiology service in our service area.
Now, I went back and looked at the press release, and this announcement came out about mid-March, so it's been in place for a couple of months now. How are things going?
Very well, very well. We've been off to a good start and have office open and seeing patients on the floor. We're off to a good start.
All right. And Dr. Karras, you're new to the community?
Yes, indeed.
All right. So tell us a little bit about yourself and your background.
Well, I originally was born in Boston, Massachusetts. My initial education was in pharmacy, and then I went to graduate school in pharmacy and got a doctorate degree. Following that, I did research in neurology and then medical school.
Okay. And then I guess kind of how did this whole partnership come about? And can you kind of talk, and Jim, this might be more directed toward you, but how exactly this unfolded?
Yes, we were really looking to expand coverage to our service area and our community to 5 days a week for cardiology and began looking at partners in the area. And the Franciscan Physician Network really stood out as a quality organization that was able to provide that coverage for us.
So what can you tell us about the Franciscan Physician Network?
We're a hospital network, a group of physicians that provide services for all the needed medical areas. Obviously, cardiology is my area. And we're here because we understand the vitality of a community hospital is dependent upon the support, the trust, and the faith that their citizenship has. We're here to convince them, to reassure them that we can provide their cardiology services to keep them within the institution, and if need be, can transfer them to our Franciscan network. I grew up in a small hometown. It was 2 by 2. What people wanted in that hometown is to keep people there, their families there. They didn't want to have to run to the big city. We're here to tell you that this can be the big city because we have the capabilities of providing everything, with the exception of a small degree of very technical cardiac surgery here and in St. E if needed.
That's fantastic news. And having talked with you guys from the hospital for the last couple of years, that's one of your goals is keeping people here, right?
Yes,
Absolutely. Yes.
Now, one of the changes you mentioned is expanding to 5 days a week. I would imagine that that's something that was definitely needed in the community.
Yes, absolutely. Our volumes have been growing in this area as our community ages and diseases progress. Our volume in cardiology has been growing over the last few years. And as well, it's more than just 5 day a week coverage. That's office coverage. It's really call coverage for our inpatient areas and ER to have those cardiology consults available readily from a concentrated group.
So the Franciscan Physician Network, the cardiology clinic, is yourself and 2 additional doctors?
Yes, we have 2 fabulous partners. We really supply all the necessary parts of cardiology. In cardiology, there are 3 parts. There are the plumbers, those people who open up the arteries and fix the arteries in the legs. Dr. Yakub is our plumber. The electrician, that's myself. I take care of the arrhythmias and other necessary aspects of ablation, if people have heard of that. And the third is the non-invasive, the echo, the nuclear stress testing. And Dr. Artin is our lead there. And these are critical areas. But then again, we supply all the needs of cardiology. You don't have to go anywhere else. And the expertise is here. It's available now for the community.
Now, I know you have a couple of members from the office that are here just kind of as moral support for this morning, but I think that you wanted to acknowledge them.
I have to. Melinda Fortner is our lead. She has been very active, not only for our cardiology department and division at Franciscan, but in working here. Abra Timmons is the executive lead, administrative lead, who has been working with the administration here to take care of all those necessary aspects. We don't realize as physicians what goes on behind the scenes and the planning, and it's a lot of planning, and these people, they deserve and acknowledge the work that they've put in.
Well, we're glad to have you guys here. As far as you kind of touched on some of the reasons that there's an increased need for this in the community with the aging population and the increase in disease, but can we kind of talk for the listeners about some of the things that you see on a daily basis and what some of the concerns are and some of maybe the preventive measures that people can be taking?
I think and this is true of the United States of America, the three things that we fall behind the rest of the world is eating properly, our diets, exercise. We don't exercise, we don't realize the need. And as you say, preventative care. And why? Because it's expensive, because we don't have the time, because even though we are pummeled by ads, by experts talking to us, by newsprint, by other media, we just don't realize the significance until something happens. And I think we're here, and the public needs to know that something will happen to everyone. But if we follow the European guide, the Mediterranean guide, it's these three things that will, in the end, if you address, you may not live longer, but you'll live healthier. You'll have a better quality of life for the time that you are alive. And I think that is the goal.
So what are some of the signs that people should look for that they need to maybe make a change or do something different?
Everyone knows their body. People grow up, they know when something is not right. If suddenly there's a change, they don't have the energy they once had. They're sleeping all day. They just have this funny feeling, their arm, their chest, their back, when they're doing something, this is just not right. I'm not like this. Something has changed. Their waistline changes, and now they know, hey, I'm just not sleeping. I'm tired during the day. It's paying attention to the subtleties of changes. Everyone knows that. They're aware. They're intuitive. And then being comfortable discussing with their healthcare professionals. Say, listen, something is not right, and providing or having the reassurance provided to them. Yes, we need to address this. We need to take these actions. Or, no, I think this is an effect of aging. Pay attention to it, but let's not worry now.
There's no shortage of commercials and ads and Facebook posts and that sort of thing about the signs of a heart attack. But can you kind of go over what those might be?
If you read the textbooks, the description is the sudden onset of a crushing chest pain or chest pressure that radiates to the arm, the neck, the jaw, the back, including diaphoresis or perspiration, maybe sick to your stomach. Those are the classic signs. Unfortunately, most people don't read the books. So what we say as cardiologists is, if there's something that prevents you from doing activity, sudden onset where your chest feels funny or it feels heavy, and people have different interpretations. Some people say chest pain, some people say chest pressure. It's all in ferreting that out. But something that alarms them, that changes the normal course of their activity. If they wake up at night, they feel their heart beating quickly. And with that, they don't feel well. It doesn't always mean that there is a plumbing problem, a heart blockage. It means it could be an electrical problem. But it's paying attention to the subtleties of something is different. Classic symptoms, chest pain, chest pressure, shortness of breath, nausea, feeling faint. But people display, it's a continuum. They feel and explain and exhibit many different varieties.
obviously heart attack is the big one that we all think of, but you did a great job with explaining as plumber, electrician, non-invasive. There are obviously many other things beyond or before you get to a heart attack.
There are. Medicine is an art and a science. We spend 15 years with the science, the rest of our lives understanding the art. Someone comes to you and, doctor, I was walking up the stairs and I was short of breath and my chest was funny. Is this the first time it's happened to you, ma'am? No, it's happened. Is it getting worse? Yeah, it's getting worse. And one time I woke up at night and I had that feeling. Then it's for us as the professionals to say, okay, what do we think it is and how are we going to get the best answer, the quickest way without causing harm to the patient, but protecting the patient? That's our job. And we have many tools at our disposal to find that. Within each tool, the plumbing tools, the electrical tools, and the non-invasive tools. But we put our heads together to figure out, okay, this is what we think is going on. How do we get to that answer? And it's a checklist. It's like getting in an airplane. Before you take off, A, B, C, D, same thing. You hear a complaint from a patient, you go through a complete review, a physical exam, and then you make your checklist.
Now, do people generally come to you by referral from a primary care physician, or can they come directly to your office?
We welcome anything. Classically, people are within the medical system to be referred, but obviously if they see our name, if they see an ad, a Logansport ad, we're happy to see anyone at any time.
And have you been pretty busy in the time that you've been here?
It's been, yes. For a smaller community, I'm impressed. In fact, I think I was busier here for the first 3 days than I was back at St. Elizabeth when I first started a few years ago.
I don't know if that's a good thing or a bad or a bad thing community-wise.
It's both. I think the community hope that the community is starting to embrace us, trust us, the medical community, as well as the citizenship and your good listeners.
I know that through some of the data that you've shared, Vicki, heart disease, obesity, those are problems in our community. So when I say I don't know if that's a good thing for you to be busy or not, I think it is good that people are getting in to see you, but obviously this is a need within our community from the data that you guys have been able to gather.
Right. As we've talked over the last several months with our community health needs assessment, obesity, the lack of exercise, lack of preventative care, those are the primary issues that are impacting our community. And you can see how it all fits together and why it is so important, to address those issues early on.
So what are some of the major things that you've seen thus far?
I'll give you three. I've seen 2 people that required heart caths because of a suggestion of symptoms that to me appears as if they may have a blockage. I've seen one patient who will need valve surgery because one of her valve is stuck, and associated with that she has a rhythm problem. I've seen a few people with hypertension that I've changed their meds, and I've seen 2 or 3 people who just need reassurance that the symptoms they're experiencing are real, but it doesn't indicate a problem. I've seen one person who unfortunately lost her husband in November, and she was feeling chest pain, and just the reassurance was enough to just get her back on the track.
Now, when you talk about a heart cath, can you kind of talk about what that procedure entails?
Sure. All arteries basically lead to the heart. For the most part, most plumbers choose the artery in the thigh or the leg called the femoral artery. They anesthetize the area like a dentist would a tooth. They put a small tube in there, and through that tube they put another longer tube that goes up to the heart, and this is followed under fluoroscopy or using x-rays, and then shoot a dye to look at the heart arteries. And within seconds, they'll know if there's a problem. There are also, for those people who want to go home the same day and are uncomfortable lying still because of their groin, there's a new technique. It's not new, it's been out for 15 years, of using the artery in the wrist, the radial artery. Those, for the most part, can be done. Certain circumstances require people to go through the groin. Once the procedure is done, if there's a blockage, it gets fixed right away. If there are many and it needs surgery, then there are tools now where the artery is sewn quickly within the artery. The tubes are removed, patient lies still for 2 hours, and they're up and they're out.
So is that a procedure that can now be done here locally?
At this point in time, not at Logansport. It takes a large financial commitment and infrastructure. It may, if the need is there. But the beauty is we're 30 miles away, and it can be done quickly and on an outpatient basis.
So someone would go then to Lafayette?
Yes, we would either direct them to Lafayette, or if need be, we would transfer them from here, take care of them, and reassure your listeners that once the procedure is done, they come back to their doctor here. This is their home, and we understand that, and it's our home. So our interest is take care of business, bring them back to where they need to be.
I've asked you a lot of questions about the plumbing side of things, but you said your specialty is the electrical side of things. So can you kind of talk about what sort of things that includes?
Many people have heard, read the media, atrial fibrillation. It's a fast heart rate from the top part of the heart that affects many people, has many causes, and that's my specialty of taking care of that. There are people who need pacemakers because their heart's too slow, or medicines that help the heart, cause the heart to be too slow. There are now, you've heard, I'm sure your listeners heard, these defibrillators, these shock boxes, for those people who've had bad rhythms that have caused them to pass out. I put that in. So I take care of the fast heart rhythms, the slow heart rhythms that can come from a multitude of causes.
So if there one thing that our listeners could take away today that either we have or we haven't covered yet today, what would that be from you? What's the one thing that you would like listeners to take away from listening to the program today? That
now Logansport Memorial has the capability from the cardiovascular standpoint to cover, I'd say, 90-95% of the listeners' needs, and we can do it here. If we can't, very short trip to Lafayette, and then a return trip here, and they'll maintain their life's choices here and not have to run to Indy, and feel that we understand the need, because we are a small community, so we understand their needs, their wants, and their fears.
Thank you very much for all of those great explanations. I know, Vicki, I always put you on the spot with phone numbers for them, and you're prepared today. So if people want to get in touch with the cardiology clinic, how can they do that?
Well, we're located in Suite 50, which is the lower level of the Medical Office Building West, and the phone number is 753-1407. That's the direct line into the unit itself, or the cardiology center. Or they can call the operator at 753-7541 as well.
And just ask for the cardiology clinic.
And ask for cardiology clinic, yes.
All right. Jim and Vicki, from the two of you, any things that we haven't covered today that you would like to address before we wrap up this morning?
Just that we're excited to have a partnership with the Franciscan Health Network for Cardiology, and look forward to a good program.
Mm-hmm. All right. And Vicki, I know you've got the golf outing coming up.
Golf outing, June 18th. We still have room for golfers in the morning. Our afternoon is actually sold out and has been sold out for 2 weeks, so that's a good thing. So if you're interested in putting a team in, just call the foundation office at 753-1595, and we'll get you registered. And still, always taking sponsorships as well. So.
All right, and I know I just added a bunch of events to Cass County calendar from the hospital, so lots of stuff going on at Logansport Memorial Hospital, as always.
That's right.
All right.
Thanks, Michelle.
Dr. Karras and Jim Schrader, Vicki Bird from Logansport Memorial Hospital, thank you guys so much for coming in this morning.
Thank you.
Thank
It's
you.
a pleasure.
Thank you.
And that will do it for us for Talk of the Town this morning. No, it won't. That'll do it for us for Talk of the Town for this half hour. We'll be back with Dave Workman.
You're listening to 1230 AM WSAL. Logansport. News is next, then we're back with more of America's best music.